Hello again, everyone. Good morning, and welcome to our EHE Regional Learning Collaborative session on policy action to end the HIV epidemic. My name is Elena Rosenberg-Carlson, and I'm the EHE coordinator here at the UCLA Center for HIV Identification, Prevention, and Treatment Services, or CHIPTS. For anyone who might be new to the collaborative, our purpose is to facilitate knowledge sharing and support collective action across California's 8 EHE Phase 1 counties to help accomplish our shared EHE goals. And as always, we welcome folks from outside these 8 counties to join the sessions and learn together with us. So thanks everyone on the line for joining us this morning. In the chat, you should see an option to send a message to everyone. If you haven't yet, please use that option now to introduce yourself to everyone on the call by sharing your name, affiliation, and location. Next slide. So we know that policy action plays a crucial role in addressing the needs of our communities most impacted by HIV. And today we're fortunate to have 3 fantastic panelists with us to discuss different approaches to engaging in policy action to support EHE goals in California's EHE Phase 1 counties and beyond. So we'll start with presentations from our panelists, and then the last 25 minutes or so will be dedicated to panel discussion and open Q&A. As always, please feel free to submit questions at any time during the session using the Q&A function on your Zoom control panel. We'll use the Q&A function to collect and respond to questions throughout the session and primarily during the live Q&A at the end. We'll also keep the chat function open in case you'd like to share comments or resources with the group at any time during the session. I also want to note that closed captioning is enabled and can be accessed using the CC function on your Zoom control panel. And we are recording the session, and we'll post the recording and slides on our EHE Regional Response webpage within the next week. So now we'll go ahead and get started with Ayako Miyashita Ochoa, who's the Associate Director of the Southern California HIV/AIDS Policy Research Center. Thanks for joining us this morning, Ayako.
Thank you for having me. It'd be great if I can get a thumbs up to know that you all are hearing me, can see my slides. Awesome. We're a couple years into this Zoom world, and I still find myself a little discombobulated. So I'll be one of the people that constantly says, hey, am I unmuted? No, I'm not unmuted. I've been giving you a long statement of my intention without you ever hearing me. So maybe that's the way the world's supposed to be. In any case, good morning, everyone. So great to be here and to share space with my co-panelists here, Katja and Andy. I'm super excited to be able to tell you more about our work through the Southern California HIV/AIDS Policy Research Center. We are funded by the California HIV/AIDS Research Program, and there are actually 3 policy research centers that are funded by this particular initiative. And so we're just one of those 3. As you can see, our partners are listed here at the bottom. We have academic partners here at UCLA, UC San Diego, and UC Riverside. And we have community-rooted partners at APLA Health, Trevolution, the LA LGBT Center. So this is our particular unique group of folks working through our Policy Research Center. Our team is quite broad. I think there actually have been new members whose faces haven't yet made it onto this slide, but you know who you are. We're incredibly fortunate to have this really amazing team of folks that are working across all these institutions to further research that can help inform policy action. So this is just a quick snapshot of who we all are. If you have a favorite academic or community partner and you see their faces here, hey, do a shout out on chat. Always great for folks to get recognition for their contributions to this work. So what is our mission? This is a really important question for us. And in fact, we've recently undergone some strategic planning across all 3 centers to try and get to a place where we have a very common understanding of what our mission is. And so I'm going to share with you a bit of an early debut, if you will, of what our intention is around our mission. So what are we trying to do as policy research centers? And the core mission of our combined centers is to evaluate how laws and policies impact communities and propose innovative solutions with a focus on achieving equity. That's a mouthful. So what do we really mean? What we're trying to do is look at the way in which laws and policies affect people, and particularly looking at the lived experiences of people most impacted by laws and policies, and to think through ways in which we can improve the landscape and achieve equity. Now, there are many different types of equity. We've spent a lot of time talking about health equity, racial equity. We've talked a lot about different types of disparities that we see. And so much of our work sort of spans that world of, who's needing access, who's not getting access, whether that's to HIV prevention or treatment, whether that's to diagnosing viral hepatitis and accessing treatment, whether that's related to overdose and who are the people most affected by those issues. We're at the point now where we are really trying to understand HIV from the point of a syndemics framework. And so for many of you that have been working in collaboration across silos to break down those silos and work across these issues, we are also one of those sort of collaborative partners trying to do the same. And so while our mission and our initial sort of impetus for being really was looking at issues related specifically to HIV, we are now in the frame where we are able to expand our view and understand that there are a lot of social and structural issues that are common across these conditions, and that we really need to think about how it is that we can respond to a quickly changing landscape to address the issues of our day. And so how do we do this work? What's really important here is that we are always looking for ways in which to collaborate with our partners to develop rapid response research projects. What does that mean? Well, rapid in an academic space, it doesn't mean the same thing as probably you all that are practicing out on the front lines, but rapid for us is essentially trying to create short-term research projects that are able to be essentially designed, implemented, and completed within a 6 to 9 month span. And our projects are meant to quickly address questions that emerge in the policy environment. And so I'm going to be sharing a little bit about some of those projects so you get a sense or a flavor for what it is that we try to do out of our policy research centers. I'm going to go ahead and ask Elena, I don't know if you're able to do this, but to go ahead and launch your poll. Yes, wonderful. So the question here is, your level of comfort with the term policy. I'm really curious to know how folks experience this word. What comes to mind when you hear that word? What is your sort of your background in understanding what is policy? I find that we're not all in the same sort of boat when it comes to our understanding, and we all have different ways of understanding the word itself. And so I wanted to share a little bit about how I look at policy, what I understand policy to be. So yeah, if folks can go ahead and vote on that would be really helpful. Let me know if I can see the results anytime soon. That would be great. Awesome. Okay. So I would say that this is the group that has a pretty high level of comfort, from moderate and above, or high and very high. There's a good group of you that feel very comfortable with the term policy, which is really great. But I'm still going to go ahead and for the few people that, thank you for your honesty, shared, the fact that this is sort of a term that seems to potentially escape you, or you never had a chance to learn about it, to share sort of how I think about policy. So in every class when I start teaching here at UCLA, I'm in the Department of Social Welfare. And so in addition to my research duties, I also teach in our Department of Social Welfare. And our graduate students come in sometimes with very differing views and understanding of what is policy as well. So oftentimes when we start a class, I kind of teach the basics, and here we go. Here are the basics. The 3 branches of government, if you break it down, right, include the legislative, the executive, and the judicial branch. Each of those branches has a job to do. And they're different jobs. So in the legislative branch, people are supposed to be making laws. In the executive branch, people are supposed to be carrying out the law, implementing the law. And then the judicial branch is there, right, to hold everyone in check. That's the theory, to evaluate the laws. And so whenever you're thinking about, well, what is law? Oftentimes, your mind kind of goes to these three branches of government and what these three branches are doing or not doing, right? If you go to the next level of thinking, you're also thinking about how this happens at the local level, at the state level, at the federal level, right? These are all sort of similar, aligned, and sometimes separate systems that exist or coexist in a space. That's one way of understanding sort of what is law. And by that extension, I then go to the next little image there, super rudimentary diagram, but equally important. And that is to say that in the center, there's this small little box and it's called law. And that little bit right there is what we all know are things that kind of come out from these three branches of government. They're the big rules, if you will, that create floors and ceilings, meaning they tell us how far can we go with something or what is the minimum we must do, right? And so law is that very, very small box in the middle. But what you have surrounding law is a much bigger circle. It's a bigger zone, if you will. And in that zone is what I label as policy. Policy is, generally speaking, is about a course of action. It's about the small rules or the little rules, or it's the decisions that we make based on the best information we have on how we want to do things. While law might tell us how far we can go or how low the bar may be, it doesn't mean that there are any limitations necessarily that we might be able to go with policy. And so using law is sort of like this one little nugget on the inside that sometimes tells us, right, we draw the line here and we can't go any further. That policy is just a much broader tool, if you will, to help create change. So I hope that helps a little bit. Oftentimes when people think about policymaking, they think that the number one thing to do is to change the law. This is not it, meaning that that's just one small tool, but that there are many other tools to affecting change. And so as we sort of shift into talking about priority areas and me giving you some case examples of where we've used research as a tool, I do want to make a note that I know for some of you who are prohibited from advancing sort of advocacy from your particular roles, whether you work for a state or a public agency, or you're just in a position where you're not allowed to sort of directly advocate for a specific law or a specific candidate. I understand that limitation. I too work for a public institution and I am not allowed to do some of those things as well. That said, I think that each of us in our respective roles has a duty to use our abilities and our competencies to inform good policymaking. And so we can each do that in our separate realms. I often think of the world split into three, not just because of the three branches of government, but I think about it from the perspective of sort of three different jobs I've had in my life. At this stage of my life, I am doing research at UCLA. So as a researcher, I have a researcher hat. I think about my role as an attorney. When I was providing legal services, my role was to practice, and in wearing my practice hat, right? I often learned about the lived experiences of people who struggled with a lot of different issues in their life, and least of all was their HIV status, right? And the third sort of hat, or the third role, is policymaking. And, this is sort of the role that I got to play in, going and speaking with legislators and providing research evidence to help inform policymaking, whether it was to change the law or whether it was to sort of change policy and change people's ways of thinking about certain issues. For example, criminalization of people living with HIV. And so in each of these roles, I personally had things that I could do and that I did that I was able to say, okay, I'm using my capacity. I'm using my particular set of skills to help inform policymaking, to help inform lawmaking, that's the little box, to try and improve conditions for folks at the ground level. And so I just want to put out there that each and every one of you in your roles, no matter where you are in the stage of your professional development, there's opportunities there for sure. So let's go ahead and launch our second poll if we can. What is your top EHE related policy priority? It'd be really great to see here where folks land. All right. So this is really wonderful. There's definitely a variety of folks here on this call, and probably a larger group of folks working in the mental health space than I certainly expected. But I think you can see here that across conditions, there is sort of a larger group of folks working in the HIV realm. I would love to look towards the day when we have this session again, where we see even more diversity, right, of folks who are working across conditions, across areas of focus. And the reason why I say that is because, our approach as it relates to the policy research centers is not to sort of divide the world, right? We as people are complex and we have multiple identities and multiple realities. And so it's really important to think about the issues of our day in such a way that broadens the frame. And as you can see from some of sort of our focus areas with Southern California HIV/AIDS policy research centers, we like to think, again, more broadly. So while you'll see HIV and I'm looking forward to the day when even our sort of focus areas are much more broadened than that. And I think we're moving in that direction. So what is the process by which we do our policy research? I think that what's really important is that we have a process, and it's a pretty intense sort of vetting process that we do in partnership with our community partners. So I think that a lot of times it's assumed that the folks that should be designing and leading research are the folks that are in the academic space, right? And my perspective on it is actually it's the people that know what's going on, the people that are delivering services, the people that are administering programs that know better than we do what we know and what we don't know. And so our process really speaks to that. We start off with really getting an understanding of where we are on an issue. We do some preliminary data analysis. Some of that preliminary data analysis leads to disseminating information. For example, we have data on, trans persons in California. In our initial sweep, we didn't find any website that specifically focused on trans persons in California as it relates to HIV. But the next step in that is then figuring out, okay, well, how do we use those data to inform more research, right? What else do we not know? What else do we need to know? And essentially, in sort of creating products, we are almost always thinking first about who needs this information, why do they need this information, what's the best way to share this information. And so when we finally get around to the end of the circle here, where we complete our projects, whatever they may be in the different formats that they may be, we go back and again disseminate that research and use our social media channels to help do that. There are different methodologies for doing this. I won't dive too deep, but these are two of our favorite things to do. Rapid assessment protocol allows us to look at qualitative data in a very quick and dirty method to help inform policy making on the fly. Secondary data analysis is just relying on data we already have and using those to inform our approaches. Our products, I know this is a capitalistic society, so the term products might be a little triggering for folks, but nonetheless, we're thinking about who is the end user, who needs this information, and how do we get this information into the hands of the folks that most need it. And so this is where we try to diversify the different types of things we are sharing through our channels. Each of these is a link. So once these slides are shared, please go ahead and click on them. You'll get to see the variety of research products that we have out there. Not everybody learns the same way. Not everybody accesses information the same way. And so we're constantly trying to find ways to share information that might be a little different, potentially unique, and helpful to everyday folks, not only those of you that might be operating at the highest levels within your organizations. The last thing I will say is this question about data-informed policy action. How does this happen? And I will say that there's just sort of three broad ways in which our Policy Research Center does this work. And one is, again, that little box called law. We do still operate in those zones where we are trying to inform what is happening in the state legislature here in California. A good example is SB 339, which recently got pulled back from Senator Wiener's office, that having to do with pharmacy-based PrEP and PEP access. But our research was featured in an analysis that informed decision-making there. We have done research where there has been no legislation in place, but contemplated legislation. That's our work on HIV criminalization in California. And in fact, that research is what helped us figure out who we need to really advocate for as it relates to HIV decriminalization. And as it turns out, it's sex workers, people who are getting picked up on solicitation. And so that information really helped us to decriminalize HIV here in the state of California. And the last piece is informing the broader public. I never discount this piece. That there's a lot that we need to do to share more information about what is law and policy here in the state, and informing everyday people about what that is. We've done so much of that now through our subsequent work looking at people engaged in sex trade. And a lot of the great advocates in this room that have done some of that work, our research is inspired by your efforts in wanting to answer some of those really basic questions of what do people know, what do people need to know? And asking those questions has been something that we've had the privilege to do. So that's just a smattering of what we do out of the Southern California HIV/AIDS Policy Research Center. I welcome all of you to get engaged, get involved. Here are our channels, and I'm really excited now that I get to segue into one of our key collaborators, Katya Nelson at APLA Health.
All right, hello everybody. Let me just get my slides shared. Sorry, Elena, were you?
No, thank you so much, Katya. Great. Well, and thank you, Ayako, for that wonderful presentation. I just wanted to remind folks, if you have questions for any of our presenters throughout the session, feel free to start entering those right in the Q&A box on your Zoom control panel. And I'm excited to introduce Katya, who Ayako transitioned over to already, but Katya is with government affairs at APLA Health. She's the local affairs specialist and will be talking to us a little bit about their work. So welcome, Katya.
Hi, can you see my slides all right?
Yeah, it looks great.
All right, thanks. Yeah, so as Elena said, I'm Katya Nelson. My pronouns are she, her, hers, and I work in government affairs at APLA Health. So I'll talk a little bit about the work that we do here, how we engage with the Ending the HIV Epidemic initiative, and sort of what policy and advocacy work in action looks like in LA County. So to the next slide. So as some brief background, APLA Health is a federally qualified health center that provides medical, dental, and behavioral health services, as well as a comprehensive portfolio of supportive services for people living with HIV throughout LA County. We have over 40 years of leadership experience in HIV and AIDS prevention and treatment in the county, and provide trusted healthcare services to historically marginalized and vulnerable communities, especially those within the LGBTQ+ and BIPOC communities and people experiencing poverty. As some brief statistics, our patients are over 60% LGBTQ plus and 60% BIPOC identified, with about 50% having incomes of $26,000 or less annually. And as I think most folks during this webinar know, despite improvements in HIV and AIDS care and treatment, the epidemic continues to disproportionately impact Black and Latinx men who have sex with men and transgender women, with Black MSM experiencing 50% of all new HIV infections and Black women experiencing the fastest growing rate of new HIV infections. So in the Government Affairs Division, all of our work is in service to optimizing the programs, services, and health and wellness outcomes for the communities that we serve. We work to advance LGBTQ plus and social justice initiatives, such as reducing healthcare disparities, advocating for that optimal policy, programs, funding, legislation, and we work at all levels of government. All of this is interconnected. We do things like meeting and speaking with elected officials, administrators, and other key decision makers and stakeholders in the community to ensure that people living with and at risk of acquiring HIV have access to the best possible information, prevention, care, treatment, and medications. So to provide a quick example of just sort of how expansive policy and advocacy work can be, you'll see on this slide a list of the broad coalitions that we work with every day to achieve our goals. Folks will probably be familiar with at least a few of these groups and hopefully involved with some of them. So we operate both unilaterally and within this broad range of coalitions, from the local level to the California Ending the Epidemics Coalition, all the way to AIDS United in Washington, D.C. And also, as I said, in that broader network, addressing overarching healthcare issues that are important for HIV treatment, care, prevention services. So, we work with the California Primary Care Association, the National Association of Community Health Centers, the Community Clinic Association of Los Angeles County. We support initiatives including the Ryan White program, prevention programs, prevention programs at the CDC, through HOPWA, the AIDS Drug Assistance Program, Medicaid, Medicare, the list goes on and on. We also advocate for strengthening and expanding the nation's network of federally qualified health centers who play a critical role in supporting the health and well-being of people living with and at risk for HIV. So what are our policy goals? I'm not going to read them out, but on the slide, you'll see the key goals that guide our policy work. And since today's webinar is about ending the HIV epidemic, I'll speak to how our policy goals support efforts to end the epidemic at the local, state, and federal level, and how we strive to be responsive to the community's needs in our work. So starting at the federal level, and I already listed a couple of these entities here, but as you can see, there's so many different policies, programs, laws, agencies, coalitions that all play a role in how successful we can be in implementing and moving forward EHE activities, and in moving the dial towards achieving those key EHE metrics, and more importantly, in getting people well and healthy in care and prevention. We operate through a social determinants of health lens, and all of the work that we do, we want to address the needs of the whole person. And I just want this list to sort of help you visualize the syndemic nature and the interconnectedness of HIV policy work with, all these other, I'll call them general healthcare issues. And so on a day-to-day basis, we're engaging with all of these entities to make sure that their activities, their resources are supporting EHE and other work, whether this is, something like looking at making like a one-word change in a piece of policy that will maybe remove some red tape, remove some paperwork burden, somehow improve that access to care, working with something like an insurance company to improve coverage for testing, advocating to ensure that medications remain affordable for folks or become affordable for folks, working to increase resources for housing, as we know that housing is one of the most, if not the single most important intervention, especially for things like maintaining viral suppression. So in thinking about the EHE pillars, which I know it's kind of tiny, but I wanted to make sure they were on here, our policy work aims to create these broad system changes and infrastructure expansion, identifying and securing those additional resources, updating policies and legislation, increasing education for everybody, whether it's an elected official, whether it's a provider, whether it's, community who may not be yet engaged in the work, to support the pillars in terms of we want to increase folks' awareness of their status and make it accessible for them to know their status. We want to improve access to treatment, care, and all of those, wraparound and other social determinant of health guided services. We want to facilitate access to HIV prevention modalities, of which there are many now. We want to assist our local health department partners in the county in their work to respond to new outbreaks and get folks into care, into the services that they need. So moving to the state level, I want to highlight some real life examples of how we at APLA Health and in partnership with a broad group of community partners, especially the End the Epidemics Coalition, have made some great policy achievements in service to the 4 EHE pillars. So first two bills, SB 239, which updated California's HIV criminalization bills. And I know a lot of folks on this webinar played a part in this bill, so thank you for your work. This was critical in ensuring that people feel safer knowing their status and accessing treatment and prevention. This was a huge, huge piece that a lot of work was put into over many years. Additionally, sort of showing you and bringing in that connection with some of our research partners like CHIRP, SB 159, the PrEP pharmacy bill, has helped reduce barriers to accessing PrEP. This is a great example of that partnership with researchers. So some of the work that came out of CHIRP helped us, provide the information to legislators to get the bill passed, to, understand what this bill would look like in practice. And CHIRP has done follow-up work, analysis of the bill that is helping us think about what the next steps are to create even more streamlined and broader access to prevention services. So the other two bills, while not necessarily specific to HIV, highlight how we have expanded access to treatment testing services for two other issues that are part of that syndemic and part of making sure that we are helping folks not just with services they may need around HIV treatment or prevention, but also everything else going on in their lives. And then the last two pieces are examples of, the budget piece. So I know that previous regional learning collaboratives and some of my colleagues have touched on ETE budget successes, but I just want to highlight that these are a critical piece to expanding things like access to testing, treatment, and prevention. We always need more resources. I think everybody knows that. And we're always working at all levels to bring more resources in as much as we can. And so those last two pieces on here under administrative advocacy are sort of examples of policy work. So we've worked with a number of our partners whose logos you can see on the slide to ensure things like continuity of and expansion of care for folks accessing HIV treatment and prevention services, working especially to carry forward system changes we saw during the pandemic, like expansion of telehealth that had a huge impact on bringing folks into care and retaining them in care, and also helping them access not just care, but again, all of those wraparound services. I cannot emphasize enough how much our policy work in this field, we want to address all of those social determinants of health and every piece of making somebody, healthy and well. So I want to pause here before moving to the local level and talk briefly about ways that you can play a part in moving policy forward and supporting advocacy done by organizations like APLA Health and coalitions like the Ending the Epidemics. One of the easiest ways to get involved is just to sign up for mailing lists for the organizations and coalitions supporting the work that is important to you. I know that sometimes might take, going out and looking for those groups, but signing up for something like the ETE email list is really great. That coalition is a huge network. We're always sharing opportunities for things like signing on to bill letters of support, or letters of support to help us make policy changes. We offer opportunities to meet with your local and state legislators and participate in things like calls to action and days of action, which Andy will touch on. And one of the most critical things that you can do if you have one takeaway, and something that you can do, you know, no matter what you do, is if you have a relationship with any elected official, or even as a constituent, if you have a relationship with any important leaders in the field, with your public health department, you know, the leaders who may not be elected, talk to them. Tell them why this work is so important. Talk to them about what you do. Explain what the key issues are. Explain the gaps that exist. Tell them what they can do to help. Help them to become a champion for ending the HIV epidemic. Show them how they can help their constituents, how their constituents support this work, want to help people. You know, reach out to those staff in your elected office. You know, any call to them, they make a note of it. So, you know, it doesn't matter how small, it makes an impact if you reach out and talk to folks. And for those of you who policy may not be a part of your day-to-day work, so whether you work in research, whether you're a service provider, you're working directly with clients, I want you to know that your work is one of the most helpful pieces to our policy and advocacy success. We utilize data, research briefs, reports in our advocacy, you know, with elected officials, with administrative officials. These are really helpful evidence-based tools when creating policy and administrative changes, and advocating for more resources. For providers, for folks who work with clients, reach out to us, tell us your stories. At APLA Health, one thing we do all the time is we check in with our staff. We're asking, you know, what kind of challenges are you experiencing in delivering care, linking your clients to services? You know, what are you hearing from clients? What are those barriers that are preventing you from, you know, best serving your community? And this helps us identify those key policy pieces and what we want to try to achieve and to fix. Get your clients on board also. Talk, learn, connect, get them on mailing lists. I'm going to talk about the at the local level commission in a bit, but send them our way. You know, if they want to get engaged, connect them with folks. And if you still don't know where to start, my email's at the end of the presentation, and I'd be happy to connect with you to find out the best fit for you to get plugged into policy work. So for the last couple slides, transitioning over to our work within LA County, I want to start by saying that everything at the federal and local level is interconnected with our local work. And like at those levels, we have a broad network of local partners and entities that we engage with, and you can see some of their logos on the slide. I want to highlight work done by the LA County Commission on HIV, which is our Los Angeles Ryan White Planning Council, and which at a local level from the Board of Supervisors is also charged with, pardon me, watching the STI crisis. So, pardon me, I'm getting over being sick. So we're responsible for providing recommendations to the Board of Supervisors for how to allocate Ryan White resources across eligible categories. We create a prioritization list for efforts around key service categories. We ensure that overall LA County's structure supports a whole person's social determinant of health led approach to HIV treatment and prevention. I co-chair the Public Policy Committee, and one of our other activities is developing a set of policy priorities that guides our work each year. We also make recommendations to the Board of Supervisors about positions that we should take on relevant state and federal bills, things that will either help or hurt delivery of those HIV care and prevention services, and also, again, a lot of bills that address broader social determinants of health for the communities that we serve. So speaking specifically to the Ending the Epidemic initiative, we work closely with our public health department to inform local implementation of the plan, allocation of those resources, which I want to emphasize are more flexible than Ryan White funding. So that has been a game changer in sort of critical advancement of new initiatives. We also, through the commission, work with HOPWA officials at the local level around those housing access issues. And we try really hard at the commission to engage with, you know, other commissions, coalitions, local partners, stakeholders. We hold a lot of listening sessions. We always want more people at the table whatever your role is and however you're related to the work, so that we can have the best informed, the strongest coalition to try to move our policy work forward. So again, one of the other key policy activities that we do is meeting with and educating our elected officials and other county leaders. So we hold frequent meetings sort of across the board, different cities within LA County, with county staff, with, you know, our public health leadership. And oftentimes we're sort of explaining why a federal or state resource program or policy is important, how it may or may not be addressing or meeting the needs of the communities we serve, and sort of troubleshooting, identifying what the problems are and how the county can help us improve things. You know, we gather data, anecdotal evidence, those client and community stories. And so there's two things that I want to touch on, two examples. The first, and this is more about STDs, but related to the ending the HIV epidemic work. So going all the way back to 2018, we began to really see STD rates in LA County reach crisis levels. And so we worked, I'm speaking as APLA Health, working as an FQHC with the commission and with other community partners, with the Community Clinic Association of Los Angeles. And we met with the board, we wrote letters, we provided data, and we successfully got $5 million allocated towards STD services. And the generation of these quarterly reports on the state of the crisis, so we can continue to address it and sort of make sure that we are holding all folks at all levels accountable for making the policy changes that we need to see. You know, like I said, we pulled together data showing how high the rates were, highlighting certain parts of the county were more disproportionately impacted, pointed out how there were gaps in our current infrastructure and programming. And we mobilized a really large group of providers, clients, commissioners, other stakeholders. One thing we do a lot is attend various public meetings and make public comments. And so we continue this advocacy. There have been a number of other board motions and some additional resources, and we're always sort of moving forward with that work and slowly, you know, making progress towards ending the STI crisis, though there's a lot of work to be made. But so in a similar vein, you know, when we're working on the ending the HIV epidemic in LA County, we're looking at all those different pieces and working with all those different partners to figure out, you know, how we can make changes. And so I want to first give full credit to our public health department, the Division of HIV and STD programs, for these two great slides that some of you have probably seen before. But I want to focus especially on the one on the left, where you can get a sense of some of the key activities under the diagnose, prevent, treat, and respond pillar. And I want to focus on the prevent pillar as my sort of last example of at an organizational level, something that we've done at APLA Health. So over the last year, we implemented what we've called the Zeroing In Initiative, supported by Gilead. I served in a policy advisory role on the grant. And so what our staff did is we worked in partnership with the Community Clinic Association of Los Angeles County, and we identified, you know, other FQHC partners, other community providers, sort of in LA County and sort of tangentially in the field, or those who were newly funded through a set of prevention grants to expand their prevention service portfolio. And we reached out to these folks to sort of figure out, what do they know? What don't they know? What specific kind of support do they need? Who is the community that they are working most closely with? How do they feel they can make the biggest impact and expand their prevention portfolio services? And at the same time, that was a great opportunity for us to educate them on sort of all the other work going on in the HIV prevention and treatment sphere, and some of the other syndemic issues and other social determinant of health issues that inform our work, and also help broaden our network. And so we held a number of listening sessions, some trainings. We had a big event at the end of December, and we're able to really bring a lot more providers on board to expand those prevention services. So I will stop there. I just want to say thank you so much for joining me, all of us today. If you have any questions for me or want to learn more about getting involved, like I said, please reach out to me, send me an email. Happy to help you. And now I will turn it over to Andy Stone at San Francisco AIDS Foundation. Thanks.
Great. Thank you so much, Katya. Really, really appreciate your wonderful presentation. And we do already have some great questions coming into the Q&A, which we'll address during the live Q&A at the end. I'm gonna now just briefly introduce Andy. Andy Stone is our Senior Community Mobilization Manager joining us today from the San Francisco AIDS Foundation. And again, just welcoming folks to continue entering questions into the Q&A. We will be sure to address those questions after Andy's presentation as we move into the panel discussion. So welcome, Andy. Thanks for joining.
Yeah, thanks, Elena. Good morning, y'all. Can everybody hear me?
Sounds good.
Great. So I am actually really bad at webinar type formats. I do much better when I have a live audience. So bear with me, forgive me. I'm going to ask for some feedback and engagement. So feel free to throw information in the chat. Really excited to be here with y'all. And before we get started, I want to talk a little bit about community organizing, principles of community organizing, how we do it locally here in the San Francisco Bay Area, and some examples of different campaigns that we've organized. But before we get started, I want to do a really quick poll. So make sure that you participate in the poll and have your voice heard. Here is the question. So have you ever joined a protest, a march, or a rally about an issue that you care about before? We'll give folks a few minutes to participate in that. Like I said, this is a democracy. Make your voice heard, vote. Let's see those that high level of engagement this morning. I know it's morning. Let's get our coffee. Woo. And then whenever those come in, we will get a rough idea of how folks have been participating. Awesome. 74% of y'all here have, in fact, done a protest, a march, or a rally. And I'm sure many of you have been involved in a number of other ways as well, making your voice heard, participating in our democracy, and policy-making processes. Cool. So now I'm going to start my presentation really quick. I'm going to talk a little bit today about the principles of community organizing and building people power for social change. I'm going to talk about a couple of those principles as we move on. But first, I want to just introduce you to the concept to our network, our HIV Advocacy Network. So we are part of the San Francisco AIDS Foundation, but we're a grassroots group of queer, LGBTQ, and HIV activists in the Bay Area fighting to end the HIV/AIDS epidemic and to improve the lives of communities impacted by HIV. We have roughly, I believe, about 800 members across the Bay Area here in San Francisco and East Bay and other parts of the broader Bay Area. And we focus on a number of different issues. So the number of issues or buckets that we kind of prioritize include: one, health justice, access to healthcare, sexual health, HIV prevention, care for people living with HIV, all of these wonderful things. The second bucket or area of policy that we focus on is drug policy and harm reduction. How do we engage with people who use drugs in a way that respects their dignity and their unique journey around their substance use to be able to reduce harms that they may experience from their substance use? The third area is really around aging justice. As was mentioned in the chat, there's a significant number or percentage of people living with HIV who are over the age of 50 and have really unique psychosocial as well as health needs associated with aging, and particularly aging with HIV. And so we focus on this issue, particularly in San Francisco. I think over 70% of people living with HIV are over the age of 50. The next area is housing justice. Here in the Bay, as I'm sure many of you are aware, across California, we are facing an affordability crisis around housing. And this has a lot of complex implications for our community. About 1 in 6 people living with HIV in San Francisco are either unhoused or at risk of becoming homeless because they are severely rent burdened. That's a huge disproportionate impact of the housing crisis on vulnerable communities of people living with HIV. In addition to that, roughly 1 in 4, about a quarter of new HIV transmissions are among people who are unhoused. And there's a huge disparity among folks who are unhoused or unstably housed in terms of health outcomes if they're living with HIV. So there are much worse health outcomes for people who are unhoused or who are unstably housed. And this is one of the hugest disparities we see across any other breakdown of the community. And lastly, the other big area that we work on is social justice. So understanding that the communities that are impacted by HIV are quite diverse. And there are multiple different barriers that some of our community members face in terms of accessing their rights, in terms of accessing health care and being able to not just survive, but thrive. So we stand with other progressive social justice movements in order to dismantle those other systems of oppression, in order to remove those barriers so folks can really thrive. Great, moving on. Let's touch base really quickly on the fundamentals of organizing. This is going to be really quick, y'all. This isn't an expansive definition or understanding or training on organizing. This is really just an overview to help folks conceptualize and have a framework and understand what it is that we're doing and what's the theory that we have around creating social change for our community through direct community organizing. So community organizing is democracy in practice. Okay. Let's talk a little bit about this continuum of methods for addressing social change. So here's a continuum. You can see multiple different ways of addressing challenges or problems that our communities face. On the left, you have things like direct service provision. Towards the middle, you have research and education. And towards the right, you have direct action organizing, where you're bringing people who are directly impacted into the process of identifying what they want to change and how they want to change it. So each of these approaches, as you can see, exist along a spectrum. And this isn't to say in any way that one approach is better than another. They all work and support each other in a interconnected way and are all necessary in terms of addressing different aspects of the challenges our communities face. For example, if someone's unhoused, you need to meet their basic needs, right? Make sure that folks have food, make sure they have access to a safe place to stay, other support services that they need before you may be able to engage them in something like direct action organizing. But here with this continuum, there's two big pieces I'd like to kind of break out, and that is power relationships. So one side of the spectrum works more so within existing power relationships, and the opposite side, community organizing, really seeks to challenge those existing power relationships. So really quickly, I want to ask folks if you can just type into the chat, what do you think power means? I'll give folks just a second to kind of type in, what does power mean when we're talking about power? Because I know I talked about that at the beginning. How do we build community power? How do we build people power? What is power? What does that mean when we're talking about policy, when we're talking about community organizing, all this other kind of stuff? And let's see what is shaping up in the chat. Power means the ability to get stuff done. I love that. Power equals officials' money. Those who make the decisions based on money, status, race, gender, results, influence, decision-making, ability to access resources and support, parity, control, voice, privilege, ability to speak up, ability to decide and follow through. Excellent. I love these. Thank y'all for all the engagement. Yeah, so when we're talking about power, we're talking about there's usually one decision maker or a group of decision makers who have authority to make something happen. So when we talk about power, building people power from a community perspective, what we're talking about is the ability to influence those decision makers in order to achieve very specific policy goals. Okay, and so what we want to do with community organizing is really to challenge existing systems of power in order to make sure that our communities, people with direct lived experiences, are given more influence and more ability to direct the outcome of certain policy initiatives within this process. So structurally, how do we shift the system in order to be more responsive to the needs of the people who are being impacted by these decisions. That is exactly what we're talking about when we say challenge existing power relationships. This empowers the community. Cool. And if folks have questions as we go through, feel free to throw them in the chat and we'll address them in a little bit. Okay, moving on really quickly, now that we've kind of seen this continuum, I want to talk about 3 principles of community organizing. So 1, to be effective, to organize an effective campaign, community organizing needs to win concrete, immediate improvements in people's lives. If you're asking people to take time out of their day and to commit energy towards a campaign to make change happen, they need to feel that change. Right? It can't be something that's so abstract or so technical that it doesn't have a direct impact on people's lives. So that is one piece there. You need to break down the challenges, break down the solutions, and fight for solutions that are achievable, and also help people to see the difference that they have made by committing their time and energy to a campaign to make that change happen. So the second principle of community organizing is to make people aware of their own power, right? If you bring in an attorney and you threaten to sue a decision maker because they're not following the law, while that may be an effective way of creating change, it's not community organizing because it's not giving people who are directly impacted a sense of their own power to make change happen. And so that's a key component of community organizing as well. Make people feel empowered and like they have the power in their hands to make real concrete differences in their lives and the lives of their community. And third goes back to this alter the relations of power. So there are multiple different ways of doing this, but here are just a couple of examples. You can build strong organizations and groups who are sustainable and committed to the cause year in, year out. They are always there, and they are a significant stakeholder who is able to mobilize the community and defend the interests of the community when needed. So this creates a structural strategy of a group of folks who are willing to support and defend the wins that we've been able to accomplish. You can also pass new laws, budgets that address structural inequalities. This provides services that make it easier for people to be able to thrive, like I said earlier, instead of just survive. And that frees up more time for them to be, you know, to live their lives. And the third is you can build the movement by allying with other groups. Again, this is building more power. One example of power and influence, if we're looking at an elected official, what do elected officials care about? So how do we exercise power over elected officials? Throw some answers in the chat for me. How do we as a community, as people who are directly impacted, as clients, people power to influence elected officials in order to achieve our goals? So someone said, hold them accountable, feet to the fire. Okay, I love that. How do we hold them accountable? What do they care about? What do elected officials care about? Address the boards, tell the stories, attend town. Getting reelected, they care. Uh-oh, can folks hear me? Oh, yeah, getting elected. They care about getting reelected. Votes is something that they care about. So that's a perfect example of something that we as a community have an ability to organize and to bring to the table in order to influence those elected officials, right? We show that we have a number of voters who really care about this issue and that we are expecting our elected officials to do something about this issue, about this challenge that we're facing. And so that is a perfect example of how we can exercise power within a strategic advocacy campaign in order to achieve some of our goals. Great. Okay, next slide. Stages of a strategic advocacy campaign. Okay, I think I may be running out of time, so I'm going to run through some of this. Here's what an advocacy campaign looks like in terms of stages. So the first is you choose an issue. An issue is usually a partial solution to a challenge or a problem that a community faces. So what is the solution that you want to fight for? One example could be, for example, the problem may be overdoses, the overdose crisis in San Francisco. The issue that we may select is opening a safer consumption site. This is something that's small, tangible, achievable for our community, and is something that would make a direct impact on people's lives if it were to open. People would feel that immediately. Cool. So then the next stage is you communicate your solution, your issue, what you're advocating for, with the key decision maker. Okay. After that, if they give you what you want, great, you won, perfect, beautiful, move on. That's part of the beauty of building new systems and structures of power, because if you have a strong enough group, and you have elected officials who are open to hearing what you have to say, sometimes you don't have to organize a whole campaign because you've built that power. They know that you can organize people, and so they give you what you want. But if they don't, if it's a harder issue, whatever it may be, then you move on to the next piece. You begin outreach and you build your group. You want to bring in more people, more what? Voters, right? You want to bring in more people who care about this issue. You want to educate and raise awareness within the community in order to build your public support and build pressure around this particular issue in order to push the elected official or other decision maker to give you what it is that you want to help you achieve your goal. Then you stage encounters. This is where you do all the tactics that were mentioned earlier, talking about accountability, town halls, like sending letters to elected officials, giving public comment at City Hall or in the California State Senate or wherever it may be, holding a press conference, doing interviews with the media. This is all about staging encounters in order to build public awareness and pressure and momentum around what it is that you're trying to advocate for, so that the elected official or the other decision maker feels like they have no choice but to give you what you want. Right? At the end of the day, it's about a hard power analysis. There have to be consequences if the decision maker doesn't give you what you want. And so that's what it's all about. How do we build enough power to help them understand this is what the community needs, wants, and is going to fight for, and there are going to be consequences if they don't help you to achieve your specific policy goals. And then at the end, after you've staged those encounters, you win. Yay, congrats. If you don't, it means you haven't built enough people power. So you start the process all over again. You continue to build your people power, bring in more people, stage more encounters, and you continue to ramp up and escalate your tactics in order to continue to build pressure on the elected official until, once again, they feel like they have no alternative but to give you what you want or to negotiate with you in good faith. Great. Moving on, I want to give a couple of case studies. So I've got 5 minutes left, so I'm going to run through these really quick. The first is the San Francisco budget. This is a campaign we run last year, Silence Still Equals Death, a throwback to ACT UP, the militant organizing that started our movement. So what did we do? We built our people power. So the first stage of this actually was to have an advocacy priorities discussion at the beginning of the year. We held an open community town hall. We invited people from all different parts of our community, whether they be frontline service providers, whether they be people with direct lived experience, whether it be clients of our different groups, whether it be our nonprofit service providers, all these different folks to come to the table and to identify what are our top priorities as a community. From there, we built out, ways to engage with our community more broadly. So we presented to over 16 different groups in the HIV community. We organized 3 canvases out in the community, one of which you can see to the right are some of our photos. We're at the Hunky Jesus event, which was held by the Sisters of Perpetual Indulgence here in San Francisco. We were able to have a lot of fun, go out there, talk to folks in the community, raise awareness about the issues we were advocating for, and encourage them to take action. We also built knowledge and raised awareness through other different means. We created a budget priorities document that outlined our priorities, what we were advocating for exactly, why it's a problem, why the solution is a good solution or partial solution to the problem we're advocating to address. And then also exactly how much we're asking for, all that kind of good stuff. We developed talking points. We hosted a budget town hall where we talked about how the San Francisco budget process works. And we dug deeper into all these different specific initiatives and the challenges and issues related to those policy initiatives. After that, we activated our people power. We marched to City Hall and we rallied on the steps of City Hall. We had 11 different constituent meetings between folks who lived in the community who were directly impacted, our service providers, to talk to their elected officials about why these issues were so important to them, and to really push those elected officials to make promises and make sure that this funding was included in the city budget. We also were able to rally over 280 advocates across the city to send in over 3,330 emails to elected officials. We did a lot of other tactics as well. We did a little bit of media work, connected folks to share their stories with local media. We also did activations where we had long-term survivors write their stories on postcards, and then we took Polaroid photos and stapled it to the postcard, and then we hand delivered that to members of the Board of Supervisors. We engaged in a lot of different ways. It was really fun, really exciting, and folks, I think, really felt empowered by the entire process. Cool. What was the outcome? This was our budget priorities. We were advocating to preserve the HIV care safety net. There were no cuts at the federal level, so that was a check. We fought for HIV housing subsidies. We were able to obtain partial allocation of that funding, including about $1.25 million for funding for seniors and people with disabilities, including people living with HIV. We got $500,000 included in the city budget to support critical HIV service organizations in such an inflationary environment that meant that no additional funding would have been a de facto cut. So that was really awesome. And then we got $18 million for wellness hubs, which are a necessary step in moving forward to open safer consumption sites to address the overdose crisis. The fight still continues with intensive case management services for vulnerable people living with HIV and for mental health services for our HIV long-term survivors. Now, I want to say this was funding that we got in the middle of a record $700+ million budget deficit. They were talking about cuts the entire year. We flipped that conversation by building real people power, engaging with our elected officials, and really pushing for these wins. And we were able to achieve a lot. That is the power of community organizing. That is the power of democracy in action. So I just want to throw that out there. I have 10 seconds, so I don't really have time to go through the rest. We did work on MPOX. This was a great success. We got over 2,000 petition signatures. We were out canvassing at the vaccine lines, which lasted for hours every day at the height of the MPOX crisis. We were at SF General starting at 7 a.m. or before 7 a.m., talking to every single person in line saying, these are the issues. You should be outraged that you have to wait hours in line to be able to access this vaccine because our federal government has all of these vaccines sitting in a warehouse in Denmark. Why were people not responding to this crisis more urgently? So we did that work. We talked to thousands of people, got thousands of signatures onto our petition. We organized chats where people were sharing information with each other in real time. Researchers from the community, folks in public health at both the state and the local level. We had folks from local small business owners, from sex spaces who serve queer communities. We talked to a lot of other people. We organized folks. It was really exciting. We built knowledge through a couple of different town halls. We organized a lot of protests as a result of all that building of people power. We did protests outside the regional office of the U.S. Department of Health and Human Services. We did several of them, actually. We gave public comment at City Hall, at the Board of Supervisors, a special hearing on MPOX. We did public comment at the Senate Select Committee hearing on MPOX at the California state level. We also did media engagement, lifting up stories of folks experiencing symptoms and trying to access vaccines. We highlighted the gaps in the system and the failure of our government agencies to respond in a meaningful and urgent way, and really lifted up the impact on our communities. Now, what were the victories that we won? Working together with SFDPH, we helped push for a public-facing dashboard that was updated daily, that released the case counts related to MPOX so that we knew what we were experiencing. We also worked with SFDPH to push for weekly meetings with community stakeholders and community more broadly. We pushed for increased vaccine access to include eligibility for sex workers and TGNC folks here at the local level. We also pushed for increased vaccine access through an emergency use authorization that was approved at the federal level. Public health responses, San Francisco, California, and the US federal government all established a public health emergency to unlock funding and cut red tape. And we got $41.5 million in state emergency funding. And that was largely the result of the organizing that we were able to do here at the local level and with our partners across the state, some of whom are here today, and then also with our allies in New York and DC. I want to say, y'all, that we got called out on a federal webinar from the HHS talking about the work that activists on the ground were doing in San Francisco, DC, and New York to be able to push this forward at a federal level. So it has real impact and has real reverberations. ETE is our state level stuff. I'm just going to run through this really quickly. We did a day of action. You can see all of us at the state capitol. We were able to win $61 million to invest in harm reduction during the middle of an intense overdose crisis, unprecedented overdose crisis in our state. We got $15 million for Hep C, prevention, linkage, and care. And I want to encourage you to be part of this movement. If everyone can take out your phone right now, you can text RESIST to the number 52886 to receive our text updates and action alerts. Everyone, regardless of where you work, has an ability to sign up for these action alerts to be able to get information about these critical policy initiatives that we're organizing around, advocating for, and to be able to take action as a private individual, a private citizen, to have your voice heard by your elected officials, and to, just make real change happen. If folks have any questions, you can reach out to me directly, astone@sfaf.org. And there, I'm going to stop because I'm way over time. Thanks, everyone.
Wonderful. Thank you so much, Andy. We're getting lots of thank yous and claps for your presentation and everyone's presentations in the chat. So thank you so much for your information, and also just, the inspiring work that you have done and that our other panelists have done really to advance policy action to end the HIV epidemic. I'd like to invite, great. I think Katya and Ayako are back on camera here. So I'm going to invite all of our panelists now to join for a little bit of panel discussion and Q&A. Again, feel free to continue adding your questions to the Q&A box. We're going to start with a few of the topics that participants asked about really commonly during registration, and then we'll just move directly into some open Q&A. So a few of you already touched on this question a little bit, but it was so common, I think such an important question in registration, that I do want to spend some focused time on it. The question is, many of our partners in EHE across the state work in public health, clinical, and other service provider roles that don't include direct policy or advocacy activities. And some are even prohibited from participating in advocacy specifically as part of their work due to their funding sources. And so how can they contribute professionally and or personally to policy action to end the HIV epidemic? So I know, Andy, you already put out some great calls to action right at the end of your presentation, but why don't I'm going to throw it back to you if you want to share any other thoughts on that question, and then pass it off to Katya and Ayako for their thoughts as well.
Yeah, I mean, from my perspective, everyone has a right, like, especially folks who are directly involved in this work, right? You are at the front lines of the crises that our communities are facing, the challenges that they're facing. Your voice, your perspective is so important. Get involved, get informed, share the information that you have with folks, help inform these policy conversations. And as a private citizen, regardless of where you work, make your voice heard, right? Everyone's voice matters, and our elected officials have a responsibility to listen to us as constituents. So yeah, take action.
Thanks, Andy. Katya, any thoughts on that question?
Yeah, I mean, I just want to emphasize something that I mentioned during my presentation, which is, again, like, even if you feel like you can't engage in advocacy, you can inform and support policy by talking to us, talking to the folks who are doing the policy work. Tell us what you do, tell us what the challenges are, what you're seeing in your field. That you arm us with the knowledge, the data, the statistics, the anecdotal evidence, what we need when we go and talk to you know, legislators or elected officials, you know, leadership like in public health departments, whatnot. That stuff, those stories, that is so critical, and often I think the 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 piece that is most important in policy success, especially stories, when you can like bring that human element in, or provide a legislator with a, you know, a relatable story, or what, you know, what's being done across fields. It is so helpful for us. So get involved. And as a private citizen, like Andy said, be a constituent, be in the face of your electeds. So.
For me, I would give a plug to, I know there's a lot of EHEs, and our statewide coalition is the ETE, but our statewide, I'm just going to give a boost to our statewide coalition. Look, every November we have a convening where we come together, where people from all different sectors collaborate and communicate with each other. And I can't tell you how important this work is, because these are the conversations that need to be happening across sectors and across multitude sort of working areas. And I will say that one of the things that I think makes us more powerful is when we can collaborate across our respective roles. So I'm going to give you an example talking about pharmacy-based PrEP. You know, our advocates took a bill up, SB 159 up, got it passed, got it moving. And it wasn't until really we started talking to our pharmacy partners. It wasn't until we talked to the state to ask about how many people on Medi-Cal are accessing pharmacy-based PrEP, finding that really implementation was not happening. And it wasn't until we really created those robust relationships that we were able to say, okay, well, folks on the ground are telling us this is not happening. And now our role as researchers, we are triggered into action to figure out, well, what do we know and what do we not know? We are all using our skill sets, our respective skill sets, our basic, you know, sort of our knowledge and our tools to help inform what comes next. And so while what comes next looks like the kind of amazing advocacy Andy does, or the amazing advocacy Katya does, it can also come in the form of coming together to create solutions together. And that in and of itself is policy making, y'all. So I really, really encourage everyone to understand you do have an important role to play. And the more that you get into the sandbox together with all of us, the more our solutions will really reflect the actual true needs that have to be met and that are the most demanding for the people in greatest need.
Thank you all so much. I'm going to take us into one other question that was commonly asked during registration, and then we'll just move into some open Q&A. We have some great questions coming in to the Q&A box. So this question is, what resources can EHE partners use to learn more about EHE related policies coming down the pike and get involved? The ETE Coalition, of course, was already mentioned, and I did put, you know, a link there in the chat so folks can learn more. But are there any other resources you all would recommend folks look into, you know, federally, state, locally, any other resources? And maybe we can start with Katya on that question. Katya, any resources you would recommend folks use?
Yeah, I mean, I think I'm trying to think how I sort of got on the millions of listservs that I'm on. I am going to say that ETA is a good place to start, because so many different folks are involved with that coalition that, you know, when you see an email come through saying, you know, like, hey folks, I'm so-and-so from this other coalition, we have a letter of support for, you know, X bill, you know, please consider sending it. You know, you can look and see, like, ones that come to mind. You know, there's like the Protecting Immigrant Families Coalition, there's Care for All Coalition. At the federal level, there's like, you know, Prep for All. We have a number of different sort of Google groups, and so you can see those and then reach out to those folks to get on their listservs and sort of build out this web of all of the different email lists, and then you'll get a lot of duplicates of all the things going on. But at the same time, I would say that even at it, for government entities and administrative departments, I mean, I'm on all the email lists for everything like HRSA, CDC, EHE, California Department of Health, Office of AIDS. You just kind of think about like, for a researcher, think about where you go to find information. For a provider, think about where you go for resources and get on those email lists. And over time, I think you'll get invitations to like events and webinars. And again, you just keep building out that, web of all the different places where you're plugged in and getting information and making connections. I will say that, like, it does take work and time to build it out, and you have to sort of put in that initial work to get involved. And again, I don't want to emphasize enough, like, I think us policy people, we're friendly and outgoing. We love to talk. We love to get to know you. Like, never feel afraid to reach out to somebody and just say, hey, I'm having trouble finding out how to get connected. Can you help me? We will help you. We will send you the right direction to get you where you want to be. So we're all partners in this work.
Thanks, Katya. Andy, any additional resources you would recommend that folks look into?
From a community organizing perspective, I would say, our In the Epidemics is really the group that we kind of work with. So I'm just going to echo what Katya said, and also echo the other piece that Katya said about, like, y'all, part of our jobs is really to, especially mine, is to build people power. And so that means I am an open door. I beg people to have meetings with me. Please come chat with me about how you can get involved. I will help you bend over backwards to make sure you get connected based on whatever your interests are, right? So completely agree with that. I think that's the case for almost every community organizer and for, policy advocates as well. So, yeah.
Thank you. I echo any other resources you would recommend. And I might ask you also, I think you gave a great introduction to kind of the question of what is policy. So for folks who are newer, any resources you would recommend in just kind of helping to ground them in what is policy? What are we talking about when we talk about policy?
Yeah, I have actually a 101 resource that I share with all my students. Like, if you want to go back to basics and understand really how our country is structured and theoretically how things are supposed to work, I'm happy to share that with this group of folks as well. Just to take you back to, like, basic civics. I know I never got it in high school, and I found myself at law school feeling very, very confused. And actually, it wasn't until the last presidency that I really dug deep into constitutional law and understanding the limits of our democracy. But also, to Andy's point, to understand, how do we flex? And that the fourth branch of government we never talk about is people power. And so the only way to really realize that is to actually do it. So I will share that resource, Elena, to answer your question. I just also want to echo that almost always when an issue comes up, particularly at the practice front, my first thing to do was email Katya or email Craig. Craig Pulsifer, shout out. You have go-tos in your community. You say, hey, is anyone working on this issue? Who do I go to? How do I do something about this problem? And what you get from that response is really an understanding, okay, where is change most likely to happen and how can you affect change? And so folks that are working in the policy space can quickly identify that for you. It's what I did. It's what I recommend folks to do when you're seeing things out there and you're experiencing things out there that you think, oh gosh, is this right? Most likely not. So how do we go about fixing it?
Thank you. We have a couple of more specific questions that we received from participants on the line. This one is for Andy. The question is, do you do any work to persuade bureaucrats and bureaucracies to work more with people and to work less to deny their services to people?
Yeah, that is an area we are actively looking at building a little bit more power around. We haven't engaged as much with state and local agencies. One example of this that we have from a people power community organizing perspective is around MPOX. and working with, San Francisco Department of Public Health to kind of change vaccine eligibility for folks who were at risk, including TNGC folks and folks who are engaged in sex work, and also around, other pieces, right? Trying to expand access for people who are monolingual Spanish speakers, all kinds of incredible things like that, right? And so we do a little bit of that. Really, our work is around systems change. So that is, are there issues that are broadly impacting the community and multiple members within the community that are actually a significant barrier? And so that's something that we are looking at expanding our power a little bit more into. I think we're probably going to set up meetings this fall with some of our folks at DPH and our Mayor's Office of Housing and Community Development to talk through some of the latest funding that we've gotten through the city budget, because it is critically important, the implementation piece of this. We have had where we have organized the people power, and then somehow on the back end, it doesn't translate into funding where it needs to go. And that is a problem. So, there are definitely some conversations that need to be had there. And yes.
Thank you. Katya, this question, I think you already answered a little bit in the chat, but we got a couple of questions about the bacillin shortage. Can you just address any kind of policy action to address the bacillin shortage and cost concerns?
Yeah, so I've been thinking, I saw a number of people commenting on this in the chat, and I've been thinking about it. And I mean, I don't have any sense of when we're going to see more. Like I said, I understand there was an issue at the plant. And so it's one of those, like, when are we going to get more? This is a huge crisis. But what I can say is, sort of in the spirit of talking about policy work, how would we go about approaching an issue like this? So, first we need to understand what's going on. We want to arm ourselves with the data that's out there. I posted a link in the chat. There's anecdotal evidence from a survey that the National Coalition of STD Directors put together. We have things like guidance from CDPH, their provider letter. Then, we want to talk to other, providers, stakeholders, find out, what other people are experiencing with the shortage, what, solutions or troubleshooting they might be doing. And you sort of build your group of folks who then, you want to go to your elected officials and your county leadership to make them aware of the issue if they're not already. In our case, our Division of HIV and STD Services is doing a great job already with this. Like, they know it's an issue. They're doing everything they can to, especially prioritize, treatment for pregnant people, doing what they can to there's the piece in the letter about conservation guidance. So, and they're, at the commission providing updates about the shortage and talking about how they're addressing it locally. So given that they sort of know what's going on, our next step then is turning to our board of supervisors. We have options like asking them to send a 5-signature letter to the relevant parties, in Congress and, federal level administration, asking them to draw on their connections at the state and local level. We need to reach out to our state and federal representatives as well, make sure all of those different elected officials and all of the different administrative officials understand how big of a crisis this is, put that community pressure on them to see if they can do something, and in the meantime, we sort of do the best we can with the resources, that we have. I think we don't have time to talk about it in this session, but I think knowing what we saw with like the monkeypox response, and vaccination efforts, sort of all of that was a huge people power, making noise moment. So that's sort of the best that I can offer now. I don't have a solution, but it is a huge issue. So.
Thank you. We are in our last minute of today's call, so we wanted to close with a little call to action opportunity and really kind of reflective opportunity for everyone on the line. The questions here in the chat, which is, what is one way you feel you can participate in and or lead policy action to help end the HIV epidemic? So we'd love to hear your thoughts for everyone on the line. What is one way you feel you can participate in and or lead policy action to help end the HIV epidemic? You can just share your thoughts in the chat. And while folks are answering that question, I just wanted to thank our fantastic panelists one more time for sharing your incredible work and your insights with all of us today. And also wanted to thank all of our attendees for your great engagement and questions that you contributed to the discussion. As usual, please look out for a follow-up email from me with relevant information from the session, including the session recording and slides and a link to the evaluation form. And we invite you to, again, thank you so much for those already answering this question in the chat, letters to legislators, vote, talk about it. We invite you to continue thinking about this final question as we close the session today, and really to get involved in policy action to end the HIV epidemic. So thank you all again so much, and have a wonderful rest of your day. Bye, everyone.